Ashton, what are your thoughts about the Merck pill to treat COVID?
Oh, I think when you talk about this antiviral pill, for example, that's being developed by Merck, they are asking for emergency use authorization. It's possible, I want to underscore possible, that we could see that by the end of this calendar year. And people should think of that similarly to the medication Tamiflu as both prevention and treatment for influenza. So I think that the more we have in our toolbox, the better we will be. But whether it's the Regeneron antibody cocktail or this Merck antiviral pill, they are not substitutes for vaccination. This is about a situation where medically, I think the evidence is pretty clear. You want to do more and not less.
And we've talked about the Delta variant so much, Dr. Ashton. It seems to now be the dominant strain, at least in our area in the Midwest of the country. Should we be concerned about more variants in the future, maybe the near future, as we grow closer to the holiday season? Or do you believe the Delta variant is what we will now call COVID-19?
That's a great question, and I think the short answer is yes, we should all be concerned about the emergence of new variants. You know, as the saying goes, viruses mutate for a living, so as long as there is a part of the world where this virus can circulate and replicate, there will be new variants. Whether those variants are more dangerous to human beings or not remains to be seen, but that is always the possibility. So that's why there's a push to vaccinate so many people, not just here in this country, but around the world. And really, if you talk to infectious disease experts, they say right now it's all about Delta, but tomorrow it may be another variant. So that's why we can't relax and we can't take our eye off the ball when you talk about what we're dealing with this pandemic and dealing with this virus.
Vaccine mandates, obviously a big hot topic right now. We're seeing it with government workers, then California became the first state for schools. So should we be vaccinating children, and should it be required for them to attend school?
Well, first of all, you know, I like to stay in my lane, and my lane is one of being a doctor and that of science. Luckily, I'm not making public policy, and I'm not an elected politician or part of the administration when it comes to, you know, corporations or school districts. But I think that we've seen, certainly in the course of this pandemic, that vaccine mandates are effective, and there is a precedent there in public health. You know, in my hospital, for example, in the suburbs of New York City, it is required to show that I'm tested and negative for tuberculosis every single year for me to work at that hospital. They also require influenza vaccination, and children have a certain amount of childhood immunizations that are legally required for that child to attend school. Luckily, it's not my decision to make, but I think that it's a very fine line between respecting someone's autonomy and protecting not only that person, but the public health and well-being. So I think that we're in uncharted waters in some ways when it comes down to this. But when you talk about the pediatric age group, I can tell you in all of our talks with the FDA and CDC here at ABC News, they have reassured us time and time again they are not taking any chances in terms of safety with this age group, and they are prepared to take their time and enroll more participants in these clinical trials to make sure that if they give authorization or approval in this pediatric age group, that they are taking no chances when it comes to safety.
Dr. Ashton, last question. We've talked about it for the last year and a half. You have and we have, for good reason, is COVID. But we are getting into what is traditionally the flu season. And last year, we basically had data showing us there was virtually no flu, at least in our area. Are you concerned about this flu season now that there is so much stress on COVID that people aren't going to get their flu shots at the normal rate they usually do?
I'm glad you asked about influenza. You know, the short answer is I'm always concerned about flu because the only patient I've ever had die in my medical career was a patient who died of influenza, happened to be a pregnant teenager. So I take it very seriously. I've had influenza twice, even after having been vaccinated, because the efficacy hovers around 35–40%. And I can tell you that as a young, healthy person, I actually thought I was going to be hospitalized and put on a ventilator. I've never been so sick in my life. So I'm always concerned about it. The concern with respect to this country this season is that we saw relatively zero influenza last year. So there's not a lot of natural immune protection against flu here in the United States. But as the saying goes, flu season is unpredictable. We really won't know what we're dealing with until it's behind us. And that's why the CDC is still vigorously recommending that people get vaccinated whenever they can. Certainly by the end of October is the CDC recommendation, but it is never too late. And I will be getting my vaccine next month for sure.